Mike Gibson, Barry Borlaug here, and we are talking about the rapid heart failure study. Does rapid atrial pacing improve outcomes in those people with reduced ejection fractions? Barry, what do you do and what do you find?
Well, we've known for many years that patients with HFpEF have chronotropic incompetence more than half. Um, so it's been tempting to believe that increasing the heart rate with things like pacing would help improve exercise capacity, but it's never been shown. So this was a randomized crossover trial where we implanted permanent atrial pacemakers into patients with HFpEF. And we programmed them for rate responsive pacing during exercise, no increase in the resting heart rate for a month, did an exercise test, let that wash out, and then had them with pacing off for a month and another exercise test. And the order with which they got pacing on or off was randomized, so it was a crossover design. And the primary endpoint of the study was exercise capacity measured by VO2 oxygen consumption at anaerobic threshold. But we also looked at peak VO2 as a measure of maximal exercise capacity. And we saw that the ability to increase heart rate with the pacing off was strongly associated with exercise capacity, which we've known for years. And we also saw that with pacing, exercise heart rate increased very significantly. But contrary to our hypothesis, and despite the fact that heart rate went up more, there was no improvement in exercise capacity.
Wow. So contrary to what you thought, that's always, to me says you did the right experiment, was an honest one. Why do you think your hypothesis wasn't fulfilled?
Well, fortunately, we hedged our bets a little bit to try to understand the mechanisms. We performed a non-invasive assessment of cardiac output at rest and exercise using a technique of acetylene rebreathing. Acetylene is a gas that is soluble in blood, so the rate of uptake in the lungs is proportional to the cardiac output. So this allowed us to say, okay, heart rate is going up, but is cardiac output going up? Because we would expect the heart rate increase to only help if it increases cardiac output. In fact, we saw that despite the fact that heart rate went up, there was no increase in cardiac output. And this was because stroke volume went down. So obviously cardiac output is stroke volume times heart rate. So the heart rate was going up, but we saw no bump in cardiac output. So it stands to reason that patients aren't going to be able to exercise better. So
And
we
these
think
were
that's the explanation.
these were HFpEF people, so they really couldn't increase their stroke volume. I mean, was that the impediment here, even though they're pacing fast, going faster?
That's what it looks like. Yeah. We don't have like really detailed assessments to see if the inability to increase stroke volume was due to inadequate preload or end diastolic volume or inadequate enhancement in contractility and systolic volume. But we do know that the stroke volume didn't go up as much pacing on.
Look, you ask an honest question, you do an honest study, you get an honest answer. That's what we need. Great job. Thanks for sharing with us, and thanks to all of you for joining us here live from ACC 2023.